welcome. Thanks for joining us for Pulse on Paws, courtesy of St. Francis Animal Hospital. I'm Dr. Candice Berkshire. I'm one of the associate veterinarians here, and I'm really excited to share with you some tips on pet care. So, it's Senior Wellness Month, but one of the first things to know is, what does senior mean? And senior is a moving target. We used to say senior at 7, but is that senior dogs, senior cats? It has a lot to do with your pet's size, their species, their breed. So the average indoor-only cat is going to live between 15 to 20 years. So I look at a 10-year-old cat and I think, kind of senior, but kind of middle-aged. Whereas giant breed dogs tend to have lesser degree of longevity. Great Dane is definitely senior, bordering geriatric at 7 years of age. And all of that is, again, impacted by genetics. So certain breeds are prone to earlier loss or a shorter lifespan, but maybe this particular group has been selected for longer longevity. So it is variable, but a good rule of thumb is that cats are senior, or at least advanced middle age, at about 10. Small breed dogs are maturing, again, at 10. A large breed dog or a giant breed dog, I might start talking about senior care at 5 to 7 years of age, depending on their size or their predisposing factors. I started doing senior care on my Dobermans at between 5 and 7 years of age, depending on what testing I wanted done. Certainly, when you come to St. Francis, you're going to hear us talking about senior wellness blood work at 7 years of age for most dogs and 10 years of age for most cats. But you can ask 5 different veterinarians and get 5 different answers because, again, senior is a moving target. What's true for one pet is not true for all pets. One of the first questions we got was actually a wonderful springboard for the topic, which is, talk to me about my pet's supplement needs, dietary needs, etc. I probably have this conversation several times a week, and I think the information is applicable across all ages, but becomes especially important as our pets mature. Supplements are so popular. We feel like we're doing something for ourselves, for our pets. But there is some really good research to suggest that some of them are actually more worthwhile than others. Specifically, let's talk about joint supplements. Many people have seen that their pet food is labeled as having joint supplements in it. And that's wonderful. Most of these products do contain added levels of glucosamine, fish oil, things like that. However, because of the regulatory statutes, a pet food manufacturer cannot put therapeutic levels of a supplement in a food and still label it as a food. Which means when you're buying an over-the-counter non-prescription joint diet, it has limited amounts of glucosamine, chondroitin, omega-3 fatty acids, things like that. Less than you would achieve by adding in a dietary supplement. Glucosamine and chondroitin have been shown for years to be advantageous in joint health, but there's also some other things that make a big difference, including omega-3 fatty acids. I'm personally a big believer in supporting joints before they are painful. I would prefer to start using something like a dietary supplement well before my pet or my patient starts to show signs of joint pain, with the idea being that aging happens. I can't stop that. But what I can do is slow the progression and improve quality of life leading up to that time. So what I would recommend is that any senior pet be on a good quality joint supplement. And the best thing to do is to do your research, but also check in with your veterinarian about what may be appropriate. Omega-3 fatty acids are not appropriate for pets with clotting abnormalities. Glucosamine has been implicated in people in artificially elevated blood glucose levels. So if you've got a diabetic pet, maybe we need to have a conversation about that. So it really does become a matter of having a collaborative conversation with your doctor about which supplements are best. But again, an over-the-counter diet is not going to contain therapeutic levels of these ingredients. But all that aside, I don't want to negate the value of a senior diet. Most senior diets tend to have moderate calorie restriction to compensate for the fact that, unfortunately, as we age, our metabolisms slow down and we tend to burn fewer calories. So there's a variety of things that are modified in a senior diet. Just know that a senior diet or an over-the-counter joint diet is not going to be a standalone for your pet's joint health. There are some prescription diets that fall outside of that regulatory requirement, so that's a different story. But just know that if your pet's diet says senior formula with added glucosamine and chondroitin and omega-3 fatty acids, yes, it does have those added at higher levels than a maintenance diet, but probably not at a therapeutic level. Just to put it in context, my 8-year-old Doberman is currently getting 3 glucosamine chondroitin supplements and 3 glucosamine chondroitin and 3 fish oil, or high concentrated omega-3 fatty acid supplements. So she's on a bunch of stuff and she's not having any major issues, but I'm still taking that approach to try to slow down the progression of her joint disease. One of the questions from Tori was, should my pet have an orthopedic bed? And I think that really lends itself to a discussion on accommodations that we can make for our aging pets. Orthopedic beds can be great. Not every pet will be willing to use them, but certainly we know that our spinal health and our joint health are impacted by how we sleep. So yes, consider making accommodations for bedding. I used my daughter's crib mattress and turned it into a dog bed because my dogs are spoiled. So there's a lot of different options. There's orthopedic beds. Like I said, I use a crib mattress, but it's dog or cat dependent. Some of the other things we need to start thinking about, though, are things like traction aids. A lot of our pets, as they age, start to show muscle atrophy, declining nerve tone, and slowed reflexes, and they have a harder time getting around on slick surfaces. So one of the things that I like to talk to my clients about are traction aids. Either using rugs in the household, or if that's not feasible, there are several options available for giving them better traction on their paws themselves. Some are little vinyl cylinders that fit over their nails so that their nails actually create a traction surface. There's one product that's a granular rubber that you adhere to the bottom of their pad so that they basically have non-skid booties for feet. And then some people will actually use the Velcro boots that are used for hiking, and sometimes that will help. So again, making that accommodation to your pet's changing needs is important. Other things we should start thinking about are using, if your pet sleeps in the bed and needs help getting up in there, maybe it's some stairs or getting in and out of the vehicle, perhaps a ramp. It's important to remember that they're maturing much more quickly than we realize, and they will continue to do anything we ask them to because they're our pets and they love us. We need to make the proactive effort to make their lives more comfortable. One question from Isabel was talking about anxiety. In her pet's case, specifically separation anxiety and self-harming. There's a lot of different causes for anxiety in pets. As they age, we can start to see a condition called cognitive dysfunction, which is, fly on my lip, a really polite term for basically they're getting a little senile. The synapses aren't firing quite the way they used to. The neurotransmitters aren't working the way they used to. And so what we'll see in our aging pets is they start to get a little disoriented. They might get lost in their own home. They might forget the training that they've had for years without a problem. So one of the things that we start by doing is talking about comfort measures. What can we do to minimize the stress triggers for these pets? If it's a case of a dog that needs comforting and holding, sometimes something like a thunder shirt, which is essentially a compression wrap to create a sense of swaddling, that can really help. Other times, if they're having nighttime wandering and waking, I will talk to owners about melatonin as a kind of a nice, safe, low-level therapy for some of these cognitive dysfunction behaviors. In really severe cases, we will find that this is true anxiety and for a variety of different triggers, but we may talk to owners about appropriate psychotherapeutic agents and how to use them in conjunction with desensitization and kind of reprocessing for those behaviors. Taylor asked about adding a new pet to a household with a senior animal. And that's a really complex question because it's very much pet dependent. If, for example, you've got a pet who's been solitary for years, who has never minded being solitary, perhaps adding a new, young, energetic animal on a permanent basis may not be the best fit. Alternatively, if you've got a pet who's always been engaged with other animals, perhaps they would like companionship. One thing I do suggest that people try before adding a permanent member of the household is try a play date or try a temporary arrangement. So consider fostering another animal so that your senior pet is not now stuck with this new creature who they do or do not like. I personally made the mistaken assumption that my needy, anxious dog would do better if I added another anxious dog to the household. Turns out they were both anxious and neither of them needed each other. They both just needed more people time. So yes, don't be like me. Really consider what the triggers are for your pet's behavior and whether they may benefit from the addition of another animal. The other thing to consider is how a senior pet may impact training a new pet. As I'm personally considering looking at maybe getting a new puppy for my household, having lost our senior dog recently. I'm a little hesitant because my other dog has some really inappropriate attention-seeking behavior, and I worry that she's going to influence the behavior of any new pet. So these are the kinds of considerations we have to engage in. It's not a cavalier decision to just add a new puppy or kitten. Sorry for the traffic noise. It was such a nice day we had to come outside. So again, really thoroughly consider what brings your pet joy and how they thrive and how the addition of a new pet may impact that. Because again, I thought Tucker would be happier if we added another dog. Tucker would have been just happier if I spent more time with him. I think my dog wanted a stay-at-home mom and that just wasn't practical. Thank you so much for joining us. I really hope you got something out of this. I'd love to talk with you more about potentially working on a supplement protocol specifically tailored to your pet's needs. Or if you've got more specific questions about your pet, feel free to contact St. Francis. I hope you learned something and we look forward to hearing from you next time and maybe taking on some more client questions. Thank you.